Hi, thank you very much. Uh, and I wanted to tell you a little bit about my story as an that got me to where I am. I am I feel, the healthiest people I know. And and that's what I feel qualifies me as a health, a lot of what I do in the office working as patients and especially in telehealth. I've been talking about telehealth lately, and I wanted to talk a little bit about my journey, how I got to be so healthy, and explain a little bit about telehealth to you. So some of these I'm just going to let you read. My healthy transformation began with food. In 1993, I went to a vegan diet and transferred to 100% organic. I used no processed foods and I eliminated chemicals. And I really just started clean up and I had some health issues. I had Lyme disease. I had some back pain, and I was in my early 30s. And I really decided that I needed to up my game, and I really need to start thinking about my grandmother turned 90, and she told me at her 90th birthday that she was passing the longevity gene on to me. And I didn't want to be 90 years old and in poor health. And I thought, I really got to change my ways. And so I really started working on it. And I started doing yoga. I started really exploring my spiritual path. I started exploring Buddhism. I'm a very devout Buddhist at this point. And I began meditating. And then I started also not just my diet and my food, but also I eliminated chemicals and toxins from my home. Even my clothes, I buy organic and cotton and hemp clothing, organic wool. If I use anything with polyester, it's recycled polyester content. So I recycle, reuse everything I can. When I do home improvement, I find paints that have no chemicals, not low VOC, no chemicals. And, I'm just as green as I can be. And I feel that, it's also, and I feel it's kind of the Gandhi thing, be the change you want to see. And if we want a world that's clean, then we have to do that as individuals and not wait for somebody else to do it for us. Um, so I feel like I model the holistic lifestyle. And I've been doing this for a long time. At this point, I cook all my own foods, even my dogs. I don't use any processed foods. When I shop in the grocery store, I go around the perimeter. I don't go into the center of the store and buy. It's 100% organic, all whole foods, no chemicals or toxins in my home. I have a very extensive meditation practice. I meditate every morning for, honestly, 3 and 4 hours a day. I'm not kidding you. I have daily meditation practice. I walk my dogs, good 45 minutes to an hour, good 5 days a week. No TV. It's now sitting in the basement of my house that I moved into 2 years ago. Still never brought it upstairs. And I keep my screen time as limited as I can. And I go on frequent retreats. Generally every couple of months, I'm doing at least a long weekend. And in 2017, I started traveling to India because I have a guru there, and I wanted to start going there to attend meditation instruction with my guru. The best way to find yourself is to lose yourself in the service of others. And I really believe this. And so now I want to give what I have learned to others. I want to, there we go. So I want to start helping others with what I have learned. I feel like I have a lot to give in this area. One way to do this is through telehealth consultations. And it's a great way to, I'm having trouble with this. It's a great way to, there we go. It's a great way to communicate with others, and they don't even have to be in this area. And, I can impart a lot of what I've learned with others through telehealth. So what can we do with telehealth? Uh, my initial consultations are very thorough. It's usually over an hour, my initial exam. I do a very thorough review of symptoms. And then the follow-ups are very detailed also. I want to find out all the changes since the last time we talked and all the areas that we talked about to see what's improving and what's not, so we can see what needs to get better. So we include a lot of health coaching in my consultations. So I can do herbal consultations. I'm a very experienced herbalist, and I'm going to talk about that a little bit more in a minute. And we can do healthy lifestyle modifications. As you can see, I'm very qualified to talk about that. I include yoga and qigong exercise instruction where it's needed, and meditation instruction with those who are interested, and if I feel it's going to help improve their condition. So in the herbal part, as you can see, I'm an herbalist, and it could be the only raw herbal pharmacy in Maine. Many people feel it might be. And I also have granule herbs. They come in powders. And so what can herbs do? In Chinese medicine, we use herbs rather than drugs to treat internal conditions and external, actually, in the body. But I really focused on herbs for the internal conditions. And some sample conditions here, which I've found over the years, work real well and I get good results with, are GI conditions, any type of digestion issues or bowel problems, lung conditions, including colds, flus, viruses, protections about colds, flus, and viruses, any type of viruses, no matter how deadly. We have good formulas to treat and prevent it. Asthma responds real well. Mental emotional problems, anxiety, insomnia, depression, stress, all respond real well with Chinese herbal therapy. We treat much more, but these are just some good sample compositions that I've found over the years commonly come in and I treat very frequently. So there's a couple of different styles of approaches to healthcare. And one is the, sorry, I'm having trouble with this. One is the disease model, which is basically the Western or the allopathic approach. And so that's really a pretty reactive approach to healthcare, where you wait until somebody gets sick and then you do something about it. And prevention is fairly much limited to, we'll do a screening, so we do early detection. But early detection is not prevention. Early detection is early detection, but it's billed as prevention because that's all they've got. Then the other model is the wellness prevention model. And in the wellness prevention model is what holistic health providers use. And so with that model, we focus on a proactive approach of wellness and staying healthy. So you don't wait till you get to you sick to come in, you stay healthy and you prevent disease from happening in the first place. And so in Chinese medicine, we've been using this all along. It's a 2,000-year-old medicine. And we call these practices Yangshen practices or nourishing life practices. And that's part of Chinese medicine. And so in the treatment room, acupuncturists always include this. As we're talking to their patients, we find out about what's going on with their lifestyle and diet. And that's always been a part of Chinese medicine about how you treat disease. So with telehealth, we take that part of to the foremost. And so we can include all sorts of diet, eliminating chemicals and toxins from your home and environment, which cause disease, stress reduction, stress management, including exercise and meditation. It's body, speech, mind, you know, or body, mind, spirit, you know, you have to have all three. So I'd like to quickly do a case example of a telehealth case that I've been working on. This is Carol, and she came to see me for back pain with acupuncture. So we started treating her. It was getting better, but then it kept getting worse, and it turns out that the stress is worsening, and that's when she really gets the pain. So I did telehealth with her the day before her appointment. And so the therapies I've given her is acupuncture and Chinese herbs. to treat the pain and the stress. I've given her yoga stretches. I teach her how to do that to help with the pain. And I've given her meditation instruction to help with the stress, and she loves it. She's meditating, and when she gets stressed out, she finds that really reduces her stress, and in turns, the pain will go down. I've given her articles on a mindfulness approach to pain management, which she's found very helpful as well. And I also referred her to a very wonderful business coach. And I'm hoping that this person will help her reduce her work stress, which is a big part of her condition. So that's basically what I wanted to talk to you about today. Dr. Kathleen Bartlett with Bartlett Acupuncture and Herbal Medicine.